Obviously, my hope, as I had expressed to you all before, and was that we would be taking bigger steps toward reopening and moving toward some semblance of normalcy than what I'm going to be able to announce today. But the fact is that we just don't meet the criteria. And that is why today I'm announcing that we'll be extending the stay-at-home order, which expires on Thursday, April the 30th, until May the 15th. Now, for sure, there are some promising signs about flattening the curve at the state level. And in fact, we're going to report numbers today, if you haven't seen them, because I think they've been up already. 295 new cases, bringing us to a total of 27,068. Sadly, we're reporting 27 new deaths for a total of 1,697. We do have to keep in mind that these are numbers that would have been developed yesterday, and Sunday's numbers and Monday's numbers have historically been low. And in fact, I will tell you that's the lowest number of cases and deaths since March the 29th. But if you go back to March the 29th, which was also a Sunday, then by Tuesday, the numbers had increased by 5 times. And so I just want to put some context into those numbers. Obviously, we like to see low numbers anytime we can see them, but we want to make sure that there's an expectation that things might increase again. Now, I certainly don't expect a 5 times increase Tuesday, and I hope we don't see that. Louisiana has successfully stopped short of overwhelming the healthcare system, and that's because of the people who took seriously the stay-home order. They took seriously social distancing and hygiene, and I really appreciate it. There were a lot of people who did get sick, but they were able to get the care that they needed, and many other people didn't get sick. But what we know is the actions that have been taken by Louisianans all across the state have literally saved lives, many, many lives. But when we dig into the data at the regional level, the picture is less rosy. There are criteria on the White House plan that we need to meet before moving to phase 1, and you measure 3 different things. The people seeking medical care for symptoms of COVID-19, new cases, and hospitalizations. And these should all be going down for at least 14 days, while Louisiana is using that time to ramp up testing and contact tracing capacity across the state. Unfortunately, it's not the case. Louisiana does not have consistent decreases in both new cases and new hospitalizations. And it's not just 1 or 2 regions. And in fact, 1/3 of our 9 regions, Louisiana is still seeing increases in case counts. And one of those regions has actually plateaued rather than going down. With respect to hospitalizations, 2 regions are experiencing increases and 2 have plateaued. So they aren't going down either. So as I said before, the state doesn't meet the criteria for moving to phase 1 under the guidelines. In addition, Louisiana's confirmed more than 27,000 cases of COVID-19. And we estimate, under the criteria that we've been told to use, about 17,000 of those have recovered. Well, that means we've got at least 10,000 COVID-19 positive people in Louisiana right now. And all 10,000 of those became ill during the stay-home order. Just to kind of put this into perspective. And so they became ill when residents were under the restrictions to not leave their homes except for essential activities. Every single doctor and scientist who is advising me agreed that we need to be extremely cautious moving forward, and they support the decision that I am announcing today. And again, the decision to extend the date of the stay-home order is based on the data that we have, based upon science, and the White House guidance for a phased reopening for states.